Yes, sir. Good evening, respected professor and Dr. Yogesh. Today we have another section of theory question and answer discussion under PRISA DNP online academic activities. Your topic will be oxygen therapy. You can please start, Dr. Yogesh.
For oxygen, basically oxygen is an element which are very much important for our day-to-day life. Oxygen therapy is, in a patient with normal SpO2 uh, has been associated with increase in has been associated with increased morbidity, and if we give in excess, it will cause mortality also. Uh, there are some physical there are indications for oxygen therapy such as alveolar hypoventilation, peripheral causes, intrapulmonary shunt, wastage ventilation, uh, diffuse defect, increased demand. Uh, al- Alveolar hypoventilation, which include reduced central drive, anesthesia overdose, inadequate uh, N, NB in a reversal, chest injury, central hypoventilation syndrome. Peripheral causes, reduced diaphragmatic movement, post-operative pain of upper airway obstruction, intrapulmonary shunt, pulmonary arteriovenous communication, congenital heart disease, uh, endobronchial intubation, COPD, atelectasis, airway obstruction, pneumothorax and hemothorax. Wastage ventilation, which includes pulmonary embolism, pulmonary obstruction, pulmonary hypertension, cardiac failure. Diffusion defect, such as pulmonary edema, retained secretion, increased demand, which include convulsion, post-operative shivering, and hyperthermia. Uh, there are goals. Uh, O- Increase in O2 content of the blood, increase O2 delivery to the tissue. This should be achieved if PaO2 is more than 60 mmHg, that is FiO2 that is less than 0.5. Achieve SpO2 is more than 90 with FiO2 that is 0 less than 0.5. Myocardial and respiratory workload. Recommendation for oxygen therapy for patient with myocardial infarction, stroke. O2 therapy may be initiated when saturation level is less than 90, PO2 is less than 60 mmHg, respiratory distress, cardiac failure. Oxygen therapy should be initiated when SpO2 is less than 90. Oxygen therapy is titrated to maintain saturation more than 96. For acutely ill medical patient, O2 therapy is initiated when saturation is less than 90. O2 therapy is titrated when patient is unable to maintain a saturation less than 96. Um, Carbon monoxide poisoning, cluster headache, sickle cell crisis, and pneumothorax. For patient at risk for hypercapnia, respiratory failure, O2 therapy is initiated when saturation is less than 88% in hyperbaric patient. O2 therapy is titrated to maintain saturation that is more than 90. Examples uh, examples of failures, that is COPD, obesity, hypoventilation, obstructive sleep apnea, neuromuscular respiratory distress, decreased central respiratory drive, sedation overdose, encephalitis. Oxygen delivery devices, which are include low low flow and high flow. Low flow, in low flow, we can uh, its performance can be variable, which include nasal cannula, nasal catheter, uh, face mask, simple Hudson face mask, partial rebreathing mask, and non-rebreathing mask. High flow, that is fixed performance is equipped. That means we cannot adjust that. Venturi's mask, nebulizer, oxygen hood, hyperbaric oxygen, intravenous oxygen therapy, humidified high flow oxygen cannula. And sir, there are some complications related with the oxygen therapy. Pulmonary complication, that is progressive hypercapnia, occur if respiratory drive is depend on hypoxia stimulation. Inhaling high FiO2 causes hypoventilation, and hypercarbia, common in COPD patient, respiratory center, insensitive to hypercarbia drive, prevent by controlling FiO2 to 24 to 30% in COPD patients. Absorption atelectasia occur when 100% O2 is administered in COPD patient. O2 displaces all the nitrous in the airway. O2 has high solubility and thus get absorbed. O2 remain in the airway, get fully absorbed, cause alveolar collapse. Changes occur within 6 minutes of 100% FiO2. Drying and thrusting of secretion, dry O2 administration, that is nitrogen narcosis. Hyperbaric O2 therapy is needed for that. Cardiovascular complication. A rare complication of cardiovascular depression. Hyperbaric oxygen has directly myocardial depression action, especially in patients with increased sympathetic activity cause hypotension and circulatory collapse. Other complications include that is, fire hazard, depression of hemoptysis, oxygen toxicity, free radical, medical images. Oxygen toxicity includes a result from overproduction of free radical from oxygen molecule. Molecule formation, superoxide ion, hydrogen peroxide, simulate oxygen, and it's more uh, damages the structure of DNA and lipids. And protective enzyme, superoxide dismutase catalase, antioxidant, free radical scavengers, and that is glutathione peroxidase, vitamin C and D, acetylcysteine, mannitol. Factor affecting the toxicity, that is inspired oxygen concentration, time to expose, humidity, circulating catecholamine level, circulating corticosteroid level, circulating endotoxin level, leukocyte accumulation in the lung.
Do you finish?
Yes, sir.
Where did you, what is the source of your preparation of this answer? From which book or which article did you prepare this?
Sir, actually, I am not read from the article. I read from the book. That is
Oh, did anyone guide you in the department to prepare the answer? Or did you seek anybody's help? Because
sir,
this
I didn't.
oxygen therapy is often repeated question in the theory paper. Okay, so the answers you prepare should be aimed at, so you can reproduce it in your question, I mean, in your theory exam and get adequate marks. That is the purpose of this discussion of these questions in the class. Okay. So, first of all, how do you define oxygen therapy? What is the definition of oxygen therapy?
Refer to an administration of oxygen to decrease the mortality.
Administration of oxygen to decrease the morbidity.
Yes, sir.
But what amount of oxygen? Should equal to room air or more than room air?
Sir, it's more than 2 years.
Oxygen, when you say you are giving oxygen, that means you are giving it because oxygen is already available in the room air, isn't it?
Yes, sir, that is
21% is there. But
yes.
when patient needs more than that 21% and you supplement that, that is called oxygen therapy. Otherwise, normally
Yes.
every day, every minute, every second, we are all taking oxygen. So we don't
Yes.
call that as oxygen therapy. Okay. So whenever
Yes.
you are supplying or supplementing that available oxygen with an extra oxygen, that is only called oxygen therapy. Okay, more than 21%. That is, if the patient is made to breathe more than 21% of oxygen which is available in the air, it is called oxygen therapy. Okay. So oxygen therapy is needed when the patient's ability to retain or utilize the oxygen is less. Why oxygen is needed for our life? What is the importance of oxygen? What is the
To
physiology of
perform various metabolic activities in
uh,
human body.
any specific action which is very much important? Metabolic activity comprises of all these. You can say fat metabolism, glucose metabolism, protein metabolism. But ultimately, what is the main purpose of oxygen? Where should it reach ultimately? Which part of the cell it should reach? Mitochondria. Don't you think it should reach the mitochondria? Why it should go to mitochondria?
To generate the energy.
To
To generate the energy.
generate the energy by what? What is that process called? Biological
Electron
process
transfer.
where energy is produced with the help of oxygen. What is that called?
Electron transport chain.
Oxidate electron transfer is a mode, but the process is called oxidative phosphorylation. Okay? So for that, you require oxygen, and if that process is taking place, it is called aerobic metabolism or aerobic cycle. Okay? When the body is not able to do the aerobic metabolism and produce adequate energy, it goes in for anaerobic metabolism. It can still produce energy, but without oxygen. What is the difference between the process where oxygen is utilized and the energy is produced, and a process where oxygen is not available, but still some amount of energy products, ATP, is produced? What is the difference between the two?
The one
Will the amount of ATP produced same or different?
Sir, it's different.
Different. How much difference? Large difference or small difference?
A large difference.
Large difference. There will be 36 ATPs produced if you have oxygen. If you don't have oxygen, you produce just 4 ATPs. So 9 times more you will produce. Okay. Apart from less ATP production, what other harm that can happen if you have a prolonged anaerobic metabolism? Will it produce more protons, like acidosis, lactate?
Lactic acid.
So that will lead to what will be the change in the pH? More protons.
It's more acidic.
So it's lactic acidosis will happen.
Lactic acidosis.
When once lactic acidosis happens, what will happen to the other systems, enzyme systems? Will they be activated or suppressed?
Sir, suppressed because they need a enzyme need optimum.
Will they act normally or will they be suppressed? Catecholamines, epinephrine and norepinephrine, adrenaline and noradrenaline, will they have a normal activity or they will be suppressed?
It will suppress.
They will be suppressed. Okay, so we don't want that condition to happen. That is the main reason for oxygen therapy, to maintain aerobic metabolism at the level of mitochondria. Okay, so which are all the conditions which can lead to that? You must say you have been dealing with PaO2, SpO2, saturation, and the partial pressure of oxygen. More than that, you must say the 4 hypoxic conditions commonly described. What are the 4 hypoxic conditions that can lead to lack of oxygen in the body? How do you classify the hypoxia?
Hypoxia, high altitude hypoxia. High altitude hypoxia.
Priya, can you define the 4 types of hypoxia? Are you there? Shivasankari?
Sir, hypoxia, stagnant hypoxia, histotoxic hypoxia, and
We start with the most commonest hypoxia. Carrying capacity, if it is reduced, what is that hypoxia called? When will the oxygen carrying capacity decrease in the blood? Which is the most important molecule to carry oxygen?
Anemic
Hemoglobin.
Ah,
Anemic hypoxia.
hemoglobin. Anemic hypoxia. That is the most commonest. You must always start with anemic hypoxia. Then you can have less oxygen in the inspired air. That is called hypoxic hypoxia. You are in an environment where there is a less oxygen. For example, if you go to high altitudes, is there enough oxygen there? Oxygen is there, but the pressure is low.
No.
Okay. Or if
Yes,
you
sir.
are suffocated in a room, there's a burns going on, there is a lot of carbon monoxide. Will you get enough oxygen in that air? So that is called hypoxic hypoxia. Third one is heart is not able to pump. You have enough oxygen in the air, you are able to carry that, you have enough hemoglobin, but the heart is not pumping that blood to the tissues or the mitochondria. That is called stagnant hypoxia. And all these things are normal. Inspired oxygen is normal, carrying capacity is good, heart is pumping, but the cellular level tissue is not able to utilize it. Then you call it as histotoxic anoxia. Okay. So these four hypoxia types you should mention in oxygen therapy as the most important indications, how it will be helping. Okay. And then you have to go and describe what are all the conditions, clinical conditions where you will have to give oxygen, the indications for oxygen therapy. Then the second, later part, you should describe how do you deliver this oxygen? What are the devices that you use to deliver the oxygen? Then you talked about hyperbaric oxygen. If you say hyperbaric oxygen, what do you call the oxygen that is given by nasal mask or cannula or venturi mask? What do you call that type of oxygen therapy?
Low flow. Sir, low flow oxygen therapy.
Low flow is the flow rate.
Sorry. Flow, sorry.
Now the oxygen that is it given at atmospheric pressure or excess pressure? When there is a word called hyperbaric oxygen, and if you give the oxygen at the normal atmospheric pressure, what do you call that? What is the name for that? Vidya?
Sir,
Any idea what do you call that normal atmospheric pressure oxygen? The oxygen that you are giving via nasal cannula, face mask, venturi mask, or even high flow oxygen, they are all delivered at only atmospheric pressure, isn't it?
yes, sir.
Is there any particular name? When you say hyperbaric oxygen, you give it at increased double the atmospheric pressure or even 3 times the atmospheric pressure. This is called orthobaric oxygen therapy. When you give it at normal atmospheric pressure, it is called orthobaric oxygen therapy. Okay. So you must talk about the devices, then talk about hyperbaric oxygen therapy, the indications, contraindications, and lastly, you must mention the complications of excess oxygen given in your anxiety or in your enthusiasm to supply oxygen. If you go and give too much of oxygen to the patient, it will result in oxygen toxicity. Okay. So you must know how long you can give 100% oxygen, how long you should give 80%, how long you can give 60%, and what is the safest percentage of inspired oxygen that can be given for any amount of time. So if you know that, you can prevent the complication of excess administration of oxygen, which will lead to a condition called oxygen toxicity. Okay. So to learn all these things,